everybody, in this video we're going to be talking about the effects of corseting on the female reproductive system. Now, I'm not trying to be discriminatory in any way, but males generally don't need to worry about their reproductive system when they corset because all of their genitals are outside of the body as opposed to women. So is there any risk of damage on your reproductive system when you corset? Generally, no. There is a small risk of a prolapsed uterus. That's the uterus actually falling into your birth canal or completely out of your body sometimes in very rare situations. There is a very small risk of that, but that's only a risk for very, very accomplished tight lacers who, they corset 24/7 at insane reductions. So for moderate lacing, that should not be a problem. As well, there are many other reasons that a woman might suffer from a prolapsed uterus. For instance, just with age, especially after menopause, when the estrogen levels drop, you tend to lose muscle tone in your pelvic floor muscles, and that can cause your uterus to drop. Atrophy of any kind, if women aren't doing their Kegels regularly, then atrophy of the birth canal can cause your uterus to drop. As well, the risk increases if you have multiple childbirths, especially if you received some trauma during vaginal deliveries. If you've had large babies, if you had to use forceps, anything along those lines. As well, there are many other random reasons why you would have undue stress on your uterus, such as doing heavy lifting regularly, or if you are having a bowel movement and you do a lot of straining when you go to the bathroom, that can cause undue stress and cause uterine prolapse. So a lot of different things add up to it, and nobody can say for certain whether corseting is the prime culprit for causing it. So can corseting decrease your chances of conceiving a child? No, definitely not. If that were true, then the women of the 18th and 19th centuries wouldn't have been able to conceive, an average of 10 to 15 times in their lifetime. Of course, the statistics of having miscarriages and stillbirths back then were a lot higher than they are now. But once again, who's to say that that is caused directly by corseting? Because women had a lot less access to medical care back then. They had worse nutrition overall, they had no prenatal screening, and they didn't know a lot of the things they do now. Like just in the early 1900s, doctors were still saying to women that it was okay to drink and smoke when they were pregnant, and obviously times have changed. So the corseting is not, again, the main culprit for having miscarriages or stillbirths or anything like that. Now, on the topic of corseting while you're pregnant, I would not advise that at all. That would be stupid and irresponsible of me to say so. Now, it is true that Victorian women did corset their entire lives, including during pregnancy. It was considered indecent for women to be seen without a corset. However, as their bellies grew, in their second and third trimesters, they switched from their normal corset to the maternity corset, which had separate panels and laces that could be easily adjusted to the woman's body as it's changing. And this maternity corset is mostly used for support of the back and the core muscles, because since these women were corseting from a very early age, before their teens, they did not have sufficient back and core support on their own, so they had developed a dependency on these corsets. So it was not about restriction at that time, it was more about support for the mother. So today, it is true that women can do sit-ups and crunches and other exercises that can put pressure on the abdomen during the first trimester. And actually, it's often recommended, to increase your strength in your core. But I am not about to tell anybody that that corseting is good in pregnancy. If I were an expecting mother, as soon as I find out that I'm pregnant, the corset comes off like that. I am not going to put my child at risk just for the sake of aesthetics. So just as any sane, mature woman would immediately stop smoking and drinking as soon as they found out they were pregnant, they should also take all precautions possible to make sure that the health of the baby is first priority. If there are women out there who need the back support, then there are maternity support bands, or I think they're called belly belts, that you can buy to help support your back but still not constrict the belly and harm the growth of the fetus. So what causes that familiar belly pooch after you've delivered your baby? There are many reasons for it. It could be distended uterus. It could be all your other organs that have moved out of place while you were pregnant. It could be visceral fat. That's the bad fat that surrounds your organs. That one is metabolically active, and you want to take all precautions to actually reduce that as much as possible throughout your life. There is subcutaneous fat. That is the more or less safe fat that's actually underneath the skin, and that is not metabolically active. And there's also a condition called diastasis rectus, or diastasis recti for plural. And what that is, it's a condition that often happens with women in their third trimester of pregnancy, in which the muscles of the abdomen can't quite expand anymore, and there's a thin line that connects the two abs vertically called the linea alba. It literally translates to the white line. And what can happen is that splits and the muscles move apart. And you can actually do a test on yourself and contract your muscles and put 2 or 3 fingers right above your belly button, and if it sinks in, then it's a likely case that you might have this diastasis recti. So diastasis recti is actually quite common among mothers, and it has no dangers in and of itself, but because you have less support of your internal organs by your muscles, because they've moved apart, all that's separating your organs from your skin basically is the small membrane, the fascia. And what can happen is if you have a greater internal pressure, you can start having hernias. That's when your organs start kind of poking through, like little bits of your intestine. So using belly banding or corseting can help prevent that, because of course the corset provides an external pressure that kind of keeps your organs in place. And it can promote some healing of your diastasis recti, but there are no guarantees. So postpartum, all new mothers are equipped with their own little biological shrinking system, and that's caused by oxytocin. It's actually pretty cool. What happens is when a mother is nursing, or if she hears her baby cry, or even thinks about her baby at times, then the sudden rush of oxytocin, the love hormone, what happens is your mammary glands respond to that, and that is what produces letdown. That's the contraction of your mammary glands to help the milk flow better. And another organ that is also affected by oxytocin is the uterus, and so it also contracts when you release oxytocin. So what a lot of women don't know before they have a baby is whenever they nurse, their uterus is going to contract, and that's why you hear a lot of new moms saying, ow, when they're nursing, because it feels very much like menstrual cramps. So I was told. I don't really know personally. So after having a baby, mother's organs do not move perfectly back into the same place that they were before getting pregnant. But, the body is able to carry on just fine. It's built for it. Although compression gear is not necessary to help this, these organs moving back, it can help in many ways, and it can quicken the process. In fact, it's nothing new. Civilizations all over the world for centuries before even tight lacing ever existed in Western Europe have been using belly banding in many ways. For instance, in the Maya civilization in Central America, as soon as the new mother had passed the placenta, they would immediately bind the mother's stomach and keep it that way for over a month. In Spanish, this is called the Faja, which I think translates literally to a strip that you wrap around yourself. So in South India, the 3 months following delivery of the baby is called Bannon Thana. I hope I pronounced that right. And there's a strict protocol that both the mother and the baby have to follow to achieve good health. The mother is considered to be in a very vulnerable state during these 3 months, and their body is considered to be open. So they need to keep the body warm, and they need to find a way to close the body and also purge it of the bad blood and the bad fluids that have accumulated during their pregnancy. And one of the ways they do this is to, again, wrap the torso of the mother. This helps put the uterus and the intestines back into place. It helps keep the organs warm, and it also helps purge the body. In Japan, it was customary for both men and women to wear something called an obi, which is literally just a sash. For men, this obi was more narrow. It was maybe about 4 inches wide. For women, it was much wider. It was about a foot wide. And these obi could sometimes be yards long, and they just wrap them around their torsos many, many times. So the wide obi was very supportive for the expectant mother during the first and second trimesters. There is one source that states that in the third trimester, as the woman is getting larger, she would switch from an obi to something called a sadashi, which is, again, a form of binding. But I'm not sure how accurate this source is, because the sadashi is mostly referring to chest binding, especially the samurai. There are a lot of other examples of women doing postpartum belly binding in many different civilizations in many different times. So if something has been around for so long, it must be beneficial, otherwise they wouldn't do it. So I mean, if you want to do belly binding after you've had a child, then check with your doctor first, obviously. There are limitations for every woman, especially if you've had a cesarean section. You would have to do surgical compression binding, but I would not corset, obviously. But if your doctor gives the go-ahead for compression gear, then a moderately laced corset may also help. So this video is actually getting a little bit long right now, so I'll cut it here. But I hope you found this beneficial. If you have any other questions, feel free to contact me. Bye.